This is going to be quite a focused talk on one topic, women's health. We can't cover everything in women's health. So we're just going to try do a little bit today. So I decided today that we're going to do the birds and bees. Mainly the birds because they're cuter. And the main thing I really wanted to talk about was actually menstruation. So I'm actually going to play a video from the Haemophilia Academy in the UK to try and give everyone a perspective, I guess, in terms of heavy menstrual bleeding and how that really impacts women, because it's such a silent disease in a way that no one really talks about and is a bit taboo. So maybe I'll get the guys.
I've been to the bathroom 3 times this morning. Can they tell? Is this normal? Have I leaked through my clothes? Will there be blood on my chair? I have swimming later. Can I even do that? Is it still okay to talk?
Of course. You okay?
It's my period. Is it normal that it's so heavy?
It depends. Normally periods last between 2 days to a week, and you'd need a few tampons or pads a day. But girls with bleeding disorders like us can have heavy periods. Our periods can last for more than a week, and we may need to change our tampon or pad every 1 to 2 hours, or even use them together. We can pass blood clots and feel flooding or gushing of blood. The heavy bleeding can make you feel tired, moody, or dizzy.
Do you have all that too?
I did. Now I take medication during my periods to make them less heavy, and also a hormone treatment. I take the pill every day, but if that doesn't work, you can get a small coil placed in your uterus. These treatments make your periods less heavy or go away completely.
I'd have to ask my mum for that, but she just says it's normal for us. All women in our family have heavy periods.
I went with my dad to the doctor. She said periods aren't all the same and explained how different treatments can help girls like us.
And how did you handle things at school?
I told my teacher and the school nurse. I have a bleeding disorder, so my periods can be quite heavy. It felt a bit awkward, but it really helped. I talk about it with friends too. All girls get periods. You're not alone.
And what about sports? I've got swimming later.
With the right treatment and products, you can go out and be active just like your friends. Just check with your doctor. Get the right treatment, and you won't have to worry about your periods as much.
That sounds awesome. I'm going to talk to my mum about this. Thanks. I really need to go and change my pad now. I have swimming later. I can do that.
We can do something and empower these women to, return to a normal life despite having heavy periods due to bleeding disorders or other issues. So a little about ovulation. So your menstrual cycles normally starts when you start bleeding, and that's during the follicular phase. So the egg matures in the ovary during the follicular phase due to the FSH hormone, and then as it matures, it gets released, and that's when ovulation is. So that's generally about 2 weeks after you stop bleeding, and people get a little bit of pain at that time called Mittelschmerz, and then after that it gets released. If the egg gets fertilised, the bees bit, it stops the lining from being shed, but if you don't get pregnant, that lining sheds and then menstruation starts all over again. So we only really want to talk about the menstrual phase today, because I don't want to spend all afternoon talking about the menstrual cycle because I'm not a gynecologist. So essentially, normal menstruation lasts for 3 to 8 days. Generally, it's about 5 days. And they say that a normal period is about 30 to 40 mils with a period, which is about 5 to 6 teaspoons. I have no concept of how big that is unless I pick up my spoon when I'm baking, but tip of your thumb is meant to be a teaspoon. From knuckle to tip is a tablespoon, cupped hands is half a cup, and a fist is a cup. There's no way to tell how much is that on a pad and a tampon, really. So, How do we know that there's a problem? I love this definition. So anything that says there's too much blood and interrupts with your daily life. So if you can't do the things you want to do, you can't go out, you can't play sport, it's causing you distress, that's probably too much bleeding. Hopefully you're not lying in a pool of blood. So many definitions, so more than 80 mils of blood. So if you're going through the other definition, that's about a third of a cup. So, 8 fingers, thumbs. Passing clots that are bigger than 50-cent coin. Bleeding so much that you have to go to change your pad or your tampon every hour. If you have to get up in the middle of the night because you're worried about leaking or you have leaked, you have to put down a towel. You're bleeding through your clothing, so those flooding type episodes. Bleeding more than 8 days is counted as prolonged bleeding. And like I said, anything that disrupts your daily activities. So there are girls who don't go out, don't go to work, don't go to school because it's just too much of a mess. So someone very smart decided to put in a pictorial assessment chart for us. This is actually quite powerful, I find, because you can just say, I have heavy periods. Usually people are like, well, everyone has heavy periods. How heavy are they? And it was also the other way around as well. So I've got patients who I ask specifically, do you have heavy periods? They're like, oh, it's not too bad. But then you ask them, they're like, the last one I had recently was like, oh, we'll probably go through 5 super pads every day for the first 3 days. So if you do a quick check of that, that's 100 points times 3. That's 300 points already. And then you got to count any clots you pass, any episodes of flooding. So anything above 100 is heavy menstrual bleeding. So just think about that for a second. And think about how much stuff all the females in here that use. Men probably have no idea. And why do we care? So, heavy menstrual bleeding the biggest thing is that it can cause drops in your iron and cause anemia. And it can make you feel tired, so more tired than you already are from your low platelet counts. Feel weak or dizzy. This brain fog is no joke. So you can get brain fog with iron deficiency without anemia. And what I mean by brain fog is, people get irritable, mood swings, so maybe it's not just PMS, just putting it out there. Difficulty concentrating. You get mentally fatigued, so you just have less, tolerance for people, really. Lack of motivation. Some people get headaches, you get the dizziness, people get memory problems, and sometimes you just can't find the right words for it. If you're really severely anemic, then you'd be short of breath, you can't do the same exercises or walking around that you normally do, and some people do get chest pain as well on exertion. So causes. So I like to think of them in 3 different categories. Things that are related to the hormones, things that are related to the uterus itself, and then you've got your bleeding disorders where ITP falls in under as well. So in terms of hormones related, it's generally a hormone imbalance that causes irregular periods that can also affect the lining of the uterus. So if you think about the original picture that we showed you, if you're in that follicular phase for longer, that lining, so the endometrium, that lining of the uterus grows thicker and more blood-filled, that is probably going to bleed more and is going to bleed for longer. So common conditions that women get these days is polycystic ovarian syndrome or other issues with the ovaries, perimenopause, and also hypothyroidism. These are kind of easier to diagnose because there are specific tests and images that we can do for these. Likewise with the uterine pathologies, so any fibroids, polyps, endometrial hyperplasia can cause bleeding. So fibroids are non-cancerous growths that grow within the muscle of the uterus that can also interfere with the contraction of the uterus so the vessels don't constrict and they don't stop bleeding. Polyps like the polyps in the bowels also bleed randomly, so that can also increase your risk of bleeding. So like I said, the thickening, so hyperplasia just means that there's more growth of the tissue in the endometrium, so a thicker endometrium can also bleed more. Adenomyosis kind of goes hand in hand with endometriosis. It's just essentially where uterine tissue, the endometrial tissue, is in areas where it's not supposed to be. So the adenomyosis, the endometrial tissue, grows into the muscle of the uterus and stops the muscle from contracting, so you bleed longer and heavier. And then obviously, you've got endometrial cancers or cervical cancers that are rare causes of abnormal bleeding, but also heavy bleeding. So just a bit that we're all here for today, I guess any bleeding disorders can increases your chances of heavy menstrual bleeding. So as Phil said, that concrete wall, that brick wall, if the bricks aren't there, the mortar's not there, they're not going to stick together and you can't stop bleeding. So haemophilia, von Willebrand disease are quite common causes of heavy menstrual bleeding. Platelet disorders such as ITP, and also patients who have inherited platelet disorders where they don't have enough or the platelets don't work the way that they're supposed to, can also have heavy menstrual bleeding. Obviously, the things that we give you can also thin the blood on purpose, can cause heavy menstrual bleeding, which I see a lot, given that we treat a lot of clots, and also people who have underlying liver and kidney diseases that can interfere with how your clotting factors and how your platelets work, can also increase the risk of bleeding. So how do we test for it? History is number one. I didn't put it there, but you just have to, go with your PBAC. Just download it off the internet. There's instructions to teach you how to fill it in. Tell your doctor about it. They will normally do an examination. Doing a speculative exam can tell them whether or not you're bleeding from the cervix or the uterus itself. And this is a good reason to keep up with your pap smears just in case there are lesions there that are bleeding. Blood tests are important because you want to look for anemia, you want to check your iron, you want to check your thyroid, or your liver and kidney problems that might be contributing. And this might actually be might be the first time that someone else gets diagnosed with a bleeding disorder. So maybe it's not just your platelet that's a problem. There could be other reasons that is contributing to the heavy menstrual bleeding. Next steps generally is an ultrasound to have a look at the uterus and the ovaries, and this is done either transvaginally or transabdominally, depending on what we're trying to look for. And then the most invasive of the investigation is the hysteroscopy, where they go in and just to have a look. Sometimes there's just very friable tissue in there, or they can see that you've got that endometrial thickening or any polyps or any fibroids that might be causing that heavy menstrual bleeding. So in terms of treatment, it really depends what's causing the bleeding. So obviously, if there's an anatomical reason, if there's a uterine pathology that they need to scoop out, cut out, clear up, let them do it, and then hopefully it'll go away. If it's a bleeding disorder, then obviously we need to fix the underlying bleeding disorder. The desire for birth control, so we'll go through a little bit in a second about hormonal treatments and non-hormonal treatments. So if there is something that we can give you that aligns with what you want to do with birth control, that's great. So, we can prevent the pregnancy and also reduce the heavy menstrual bleeding. There are more, permanent ways of not having children. So, for women who have already had all the children that they want, they might want to have a more definitive treatment so that, that takes away that platform for bleeding, really, if you don't have a uterus or you don't have an endometrium to bleed from. And then any other medical concerns you may have. So like Rob said, we don't want patients with ITP to get clots. Hormonal treatments such as the combined oral contraceptive pill can increase clots in some patients, and that would be not a great combination if we got both. So there are medical and surgical treatments we're going to go into. So in terms of medical treatments, there are hormonal treatments and non-hormonal treatments. I think everyone is very familiar with the non-hormonal treatments, hopefully in this room. We already spoke about the tranexamic acid, so stops the body from breaking down clots so quickly, so that reduces the flow of blood, so to speak. Hormonal treatments, the most effective one that they've seen are intrauterine devices with a little bit of progesterone. And so these have been shown to be to reduce bleeding in about 97% of patients who use them. Only problem is, I think actually these two are the only ones that are on the PBS at the moment. They're about $50, but not all GPs put them in. There are only specialised GPs who put them in, or gynaecologists can put them in, and unfortunately I think the ones in Sydney, most of them don't bulk bill, which is really annoying. These pop them in, you might get some abnormal bleeding for the first 3 months, but then by that 12-month mark, people have noticed that they get very little bleeding or no bleeding at all, and they can stay in there for 5 years, so you don't have to worry about them, and also prevent pregnancy. I think there's some data coming out that they can actually be left in for longer than 5 years as well. If you don't like the idea of having a little bit of plastic in you, some people take pills. So you've got the combined oral contraceptive pills, and the most common ones are Yasmin, Levlin. And then you've got the progesterone-only pills, which is like the mini pill and the slender pill. The mini pill is a little bit hard to take. You have to take it at the same time every day. But the benefit of having a progesterone-only pill for people, especially for the people who have had a history of clots, that doesn't increase the risk of clots. In terms of surgical treatments, this is obviously aimed at removing the problems within the uterus that might be causing the heavy menstrual bleeding, so the fibroids, the polyps, and the endometrial abnormalities. The tests that they go in to have a look can also be a treatment as well. So the hysteroscopy can sometimes be combined with what they call a D&C, where they go in, dilate the cervix, have a look, and then just scrape away the friable tissue that might be more prone to bleeding. Some people can have a laparoscopic surgery or an open surgery to remove the uterus. You can get endometrial ablations where they burn away the endometrial layer, which is the tissue that bleeds within the uterus every month. And I think more popular these days is something called uterine artery embolization. I'm not sure how many places offer them. I know our institute offers them, and I've used it a few times for a lot of our patients who come in with heavy bleeding because of anticoagulation. So the idea is that they cut off the blood supply to certain areas of the uterus, and then the fibroids die because they don't have any blood supply. And I thought Phil maybe was going to go more into this, but I guess I'm only going to say two things mainly. There's oral iron and then there's IV iron. Oral iron, please take something that has more than 100 milligrams of elemental iron. So don't take the stuff that are homeopathic. Don't take the ones that go, oh, this one doesn't cause constipation. It's probably because there's only 15 or 20 milligrams of iron in there. You want the one, more bang for buck, okay? If you get constipated, just take it every second day or every third day, or only take it when you're bleeding. Just limit it, but no point taking those small doses. They don't really work. Take it away from caffeine. So we know that if you take it with caffeine, I think it reduces absorption by 70%. So I always tell my girls to take it at night before they go to sleep. So pop it on the side of your bed. Most people don't drink tea or coffee before they go to sleep. Some drink Coke, but and take it with vitamin C. Because the ascorbic acid increases the absorption by about 60% from memory. Iron infusions, the newer preparations of Ferinject and Monifer, these are the second generation ones where you can give them quite quickly. So I don't know if people have had the older preparations of iron where you're sitting there for 6 to 8 hours essentially, and that's the stuff that gives you the restless legs. And the reason why those ones are given longer is because there's an increased risk of reaction, whereas the newer ones, they've packaged the iron into a little moiety so that most people don't get the infusion reaction, so they can give it to you faster. And they can also give you bigger doses. So it's very important, if you think that the iron's not working or you still got symptoms, make sure they've given you enough. But sometimes you can get secondary hyperphosphatemia, which is actually the symptoms are quite similar to iron deficiency, so you need to be on the outlook for these symptoms as well. So if you think you've had enough and you're not feeling any better, get the GP to check your phosphate or your specialist. So who do you ask for help? Your haematologist, generally. If you don't feel comfortable, speak to your haematologist about your periods, maybe speak to your GP about it. And the best person actually is to get a gynecologist. You do want someone, you've got your platelet problem, you've got your haematologist looking at that, and then you've got your, heavy periods. Maybe you find the specialist who's going to sort out your heavy periods for you. That could be your haematologist, but I'm not going to go in and do someone's hysteroscopy or hysterectomy. You don't want me to. And I also don't like prescribing the pill, so it's better off that they do or the GP does it. I guess the main thing is there's a lot of information to try and remember. What's not heavy? I actually really like this. This is from the Irish Haemophilia Academy. It's a good screening tool for your friends, for yourself, your daughters, your sisters, whatever. Think 7-2, so if your periods last more than 7 days, so that's the prolonged bleeding. If you're going to change your pads more than every 2 hours, or it says €1. €1 is about 20 cents, 10 cents, 20 cents. So if you're passing clots bigger than that, then you need to think about whether or not you've got heavy menstrual flow. I might end it there, but this is the instruction on how to fill in that pictorial blood loss assessment chart.
Thank you very much, Sarah.